Happy to welcome our next guest this morning, Dr. Leah Bennett with Pine Grove Behavioral Health and Addiction Services. They are based in Hattiesburg. Dr. Bennett, good morning to you.
Good morning. Thank you for having me, Richard.
Thanks for joining me. I appreciate it very much. You've been with Pine Grove since 2005 as a licensed psychologist, and we know that the topic of mental health is one that continues to the topic continues to grow, but also the willingness for people to openly talk about mental health issues has grown. I know stigma is a word that gets used a lot when we talk about mental health, but it feels like a lot of that stigma, if it has not gone completely away, has at least lessened.
It's definitely lessened. I would not say it's gone away. There's still a lot of judgment that occurs with mental health and people with mental illness. But we are moving in the right direction, I would say, for sure.
What are the biggest issues that you're facing right now with patients that are coming to Pine Grove, whether for mental health issues, behavioral issues, or addiction issues? What's the kind of leading cause of people coming to take advantage of Pine Grove services?
Well, here at Pine Grove, we have a huge range of different types of patients that we treat here. And there are lots of different contributing factors to those. I mean, from the homeless population we're seeing a lot of meth use, a lot of really severe mental illness with psychosis, hallucinations. That is a huge factor for that population, all the way to our professional programs and our addiction programs. It's a lot of issues that contribute. I think people are definitely, like you said, increasing their awareness of mental health, but being able to cope with stressors and being able to understand best practices of how to deal with issues that they're facing is still somewhat limited. And so in helping people learn healthier ways of coping, healthier ways of dealing with the stressors that they're facing is really what people need more assistance with.
I know there's a correlation that exists between addiction and mental health issues. How big is that correlation? Is it 100%? Everybody that has an addiction issue, there is a mental health issue that is tied to that, or something less than that?
I would never say it's 100% because that would be hard. But you definitely see. I mean, drinking and substance use is a maladaptive coping mechanism. So people are feeling stressed, anxious, depressed, all kinds of emotions, and then they will turn to substances in order to deal with those emotional stressors or triggers that they're having. And so addiction is also, I mean, there's a genetic predisposition to addiction. And so you have, just that baseline, but then people are using those substances in order to cope with stressors in their lives in very maladaptive ways. And so that is driven by the underlying mental health issues that are so prevalent within addiction. So you see things such as, go ahead.
Go ahead. No, go ahead. I was just, this is trite. I was thinking, I feel smart because she just used a word that I was thinking about in terms of predisposition. And genetic predisposition is what you said. How is that recognizable? Because if you use an alcoholic as an example, there are people who have parents or grandparents that are alcoholics that have no issue with alcohol. Maybe they drink socially, maybe they don't drink at all because of the environment that they came in. But then you have others who have that in their family, and it seems to be passed down generation to generation. How do you identify who has that genetic predisposition and who doesn't?
Well, I mean, I think that you have to take the genetic predisposition along with the environment that the person grows up in, right? And so I can be genetically predisposed to addiction, but if I learn healthy coping mechanisms, I learn how to deal with depression and sadness and emotions in a healthier way, then I'm going to be less prone to develop an addiction. However, I mean, if you look at addiction, the genetic predisposition piece is the biggest predictor of having an addiction. So when they've looked at what leads to addiction, that is the number one. That's the number one cause. And so I think a lot of times people feel tons of shame and guilt around developing an addiction when it's just like, having blue eyes or green eyes, and having that genetic predisposition to that. But there's no way to really know exactly which ones are going to land in to have an addiction. But I think the environment that a person grows up in, and their ability to later cope with emotions definitely contributes to the realization of something either developing into addiction or not.
Visiting with Dr. Leah Bennett. She is a licensed psychologist with Pine Grove Behavioral Health and Addiction Services in Hattiesburg. Let's talk about kids a little bit.
Okay.
I think it's harder to be a kid maybe than it historically has been. Some of that is probably related to social media, to reliance on phones, tablets, screens. But that also feels like it can be a little bit of a scapegoat sometimes. I don't think there's any question that it plays a role into some of the mental issues that kids are dealing with. What are you seeing with young people right now, and what ages are we talking about?
Well, I mean, you'll have mental illness that can develop very early for children. They say that half of mental illness shows up by the age of 14. So if a person is going to have a mental illness in their life, half of them will develop by the age of 14. So for children today, I mean, I think it's always been an issue. They do deal with a tremendous amount of stressors, and the exposure to, I mean, they're growing up in a world that we didn't grow up in. And so navigating social media, navigating social bullying on those platforms is something that is very real and very traumatizing to a lot of kids. And so we're seeing difficulties for kids in learning how to manage those things, learning how to cope with all the different stressors that they do have. And so it's quite complicated when you look at children and the current issues that they're facing.
Yeah, one of the things that I've noticed, and I don't know that I would have picked up on this before I had kids that were in middle school, high school age, is that there's not a one size fits all as to who the kid is that has some mental problems or things to be concerned about. It's not just the kid that has trouble making friends. Sometimes it's the popular kid that everybody thinks has it all put together, and yet they got a lot going on that people don't see below the surface.
Right, and I think that is very true. And sometimes people think, well, if they're attractive and if they've got friends, then they should be fine. When in reality, I mean, mental illness can touch anyone, and that's something that we see over and over here. And that genetic predisposition as well for depression or anxiety is also present for other mental health disorders. And so those different factors contribute and can lead to difficulties for children or for adults. And so I do think it touches all walks of life and all different types of people.
Well, as a parent, I've got 3 kids. I got a 14-year-old, a 12-year-old, and a 7-year-old. And I think my kids are pretty well adjusted, but that doesn't mean that they're not exposed to issues that weigh heavily on them. What am I looking for?
That's a great question, and I think it's one that concerns a lot of parents. How would I know if something was wrong? To me, one of the major things that you're looking for with kids is changes in behaviors. What they normally do, what you normally see from them, any shifts in that. So, some kids are great sleepers, and all of a sudden they might have a lot of anxiety going to sleep, or some kids might be talkers, right? They talk all the time, and then all of a sudden you notice that they're really withdrawn, or a kid that is calm most of the time, and then you notice more agitation and in their day-to-day life. Those are cues for us as parents to begin to ask questions and to lean into that. One of the things that I love to encourage parents to do is to talk to their kids about emotion, like having a talk every day of, what was your high today? What was your low? Asking, did you feel angry today or sad today about something? And that normalizes that conversation for the kid, because then you can say, you know what, I felt really angry about this today. And having that ability to talk through that with the kid, again, helps normalize and helps them begin to recognize the emotions that they're having, and to be able to learn to navigate those in a healthy way, as opposed to just pretending that they're not there.
I laughed only because it's something my wife started not too terribly long ago. When we don't sit down at the dinner table often enough, but when we do, There's
Yeah.
this game that we play called High-Low Buffalo, and you have to go around the table. What was the best part of your day,
There
the
you
worst
go.
part of your day, and then what's just something that happened that was neither good nor bad. So the
Yeah.
conversation piece is important. Dr. Leah Claire
It
Bennett,
is.
thanks
It
so
is.
much for your time this morning. I hope we can visit again soon.
Absolutely. I appreciate the time.
Thank you. Dr. Leah Claire Bennett, licensed psychologist with Pine Grove in Hattiesburg, Pine Grove Behavioral Health and Addiction Services. We got more coming up with you on MRC.